And I just kept thinking about them. God, I was supposed to be helping him. It's amazing, you know, to see how far this horse has come.
It's not easy, it's hard. We would rather starve than let our horses starve. We want the horses. We want to help them. We want to be able to make a difference in their lives.
The views and opinions expressed in this presentation are solely those of the presenter and do not necessarily reflect the official policy or position of Horse Plus Humane Society, the Full Circle of Life Network, or any of their employees or management. The information contained in this presentation is for general informational purposes only and does not constitute professional advice. Any reliance you place on such information is strictly at your own risk. We strongly encourage you to conduct your own independent research and seek professional advice as needed.
The next presenter has experience all around the world. She's worked on patients from little tiny ones to great big ones, including many years at the Elephant Sanctuary. She's one of our amazing shelter veterinarians. Welcome, Dr. Lydia Young.
Hi, guys. Thank you for coming to Hohenwald. I'm really excited to get to talk to you today. I'm going to cover a really important topic. Is my mic okay? And that is the relationship between the veterinarian and the shelter. And I want to give credit to my predecessor in this role, Dr. Nancy Johnson, because she put together a lot of this presentation. And Tawnee gave it to me. And as I went through, I thought, I'm really glad Dr. Johnson gave me this because she touched on a ton of things that I wouldn't have put in here. So I think the end result is a talk that kind of covers the basis. Dr. Johnson and I have very different backgrounds. There's a lot of kind of depressing statistics in here, but hopefully it'll give you a little bit of background on if you've had difficulty getting a vet to show up, having a vet show up and not having a great experience, or getting somebody to have a more long-term relationship with your rescue. Sorry, my breath, I got here like 2 seconds ago. So just a super quick blurb about me. I've been out for about 10 years and I'm a missionary kid, so I've lived all over the place. God brought me to Horse Plus and I'm really thankful to be here. I left a career that I loved working with elephants after about 10 years for better work-life balance, which we'll talk a little bit about. Yeah. So my grandpa died at 99, and he used to always say, keep the main thing the main thing. So something that always helps me, regardless of where I am, is finding that common ground. The main thing in this case is the animals. You guys want to help animals, you're veterinarian. Now? Okay. Do you want me to do anything about it? Maybe stop moving. So throughout this talk, there's a lot of repetition, but one thing that I want to focus on is remember that common goal. We all want the main thing, and that is to make animals better and save as many animals as we can. So what's important throughout this talk to note is that you can work with your vet symbiotically. That means you guys are both doing different things to achieve a common goal, and that's really important to note because when we use our whole team effectively, we can all do a better job and accomplish a better outcome. So I'm just going to kind of go through some key essentials. Again, thankfully to Dr. Johnson, I changed a lot of her stuff, but she covered things that I wouldn't have covered. So we're going to go over common goals, clear expectations, respecting roles and boundaries, open and honest communication, and graceful endings. So to me, finding common goals is a really important thing to establish up front. Goals are based in values, and if your rescue's mission and philosophy doesn't align with the mission and philosophy of the veterinarian you're working with, you're gonna have inherent conflict in that. And that doesn't mean that if you live in a super rural area and you only have one vet, you can't come to an agreement on that, but it's being really upfront right off the bat about what you are looking for and what your expectations are. So share with any vet that you're working with what your rescue's mission is and why you're there. That's important. Veterinarians, I don't know if any of you guys have a shelter vet, but veterinarians see tons and tons of people every single day, and we're used to dealing with pet owners, right? So it's very different to work with a rescue and recognize that your mission is very different from a pet owner's mission, and that's important, and that's gonna affect every aspect of patient care. And then vision for the future is important too, right? We all are in different stages, whether we're just starting out or we're really small or we're only foster-based or we're in a huge period of growth. Make sure that your veterinary team knows those things. They might not have time to sit down over dinner with you and talk about them extensively, but make sure you can provide that and just say, hey, this is who we are, this is what we're looking for in this relationship. And I promise you, even if you get no feedback, I get tons of emails that I don't respond to at all. Vets appreciate that information. It is really helpful to us. And then something as basic as, Dr. Nancy called this chemistry, which I felt like was weird, but I think it kind of fits. This is important too, because each of us interact with animals differently, right? So it's not really a one size fits all. If you run a cat rescue and your goal is to be fear-free, and you have someone like me who barges into a room with really high energy, that might not be a great fit for you as a veterinarian. Some animals respond better to males, some animals respond better to females. We're gonna go through some depressing statistics on vets and why vets aren't available. So you might not be able to have a lineup of 10 vets to pick from, but this is important, and it's important to point out positives and also to communicate things that are hard as well. Like, hey, thank you so much for being available. We had a really hard time with how you restrained this dog. Can we talk about that, how that affects, our mission, and is there anything that we can do differently to make that a better experience? Don't be afraid to have those hard conversations. This is Dr. Nancy's wording. The first sentence sounds a bit hard to take, right? Equestrian personalities combined with a passion for rescue can potentially be a volatile combination. I'm including myself in that, right? I'm a horse person. We are passionate about what we do. There's not a single person in this room who's here for the money or just because it's a business, right? Every single person here cares a lot. We care deeply. And when we care deeply, and we have an animal that's suffering or we're really struggling, those emotions come out. So I think acknowledging right off the bat that rescue is hard and it is often very emotionally charged, whether it's something simple or not, it's okay to say that, right? It's okay to acknowledge that those things are difficult. And the more effectively we can work together as teams, the more animals we can help. And I love this, it takes a village. I have 4 kids. Literally this whole community is helping raise my children. It's not just shelter management and the veterinarian, right? It's our farrier and our trainer and anybody who's cleaning and the shelter manager. Everybody is important. Communication is important, and making people feel valued for their role and recognizing their role is really important. I used to tell our level 1 keepers at my last job, basically they got hired and for a year all they got to do was shovel poop. And I'd be like, listen, you guys are the front lines. That poop is so important. I wanna know what it looks like every day. I wanna know if it smells different. So include everybody on your team and play to strengths, utilize your team to the best of their ability. I don't talk about this super extensively, but a good veterinarian will take a look at your team and see what you're able to do, and they will delegate as much as they can so they can be really effective as a veterinarian for you. Okay, this is the second one. I feel like I'm going really slowly. Sorry. Clear expectations. We're going to talk more about relationship, but essentially hiring a veterinarian is entering into a relationship with that person. So having very clear expectations on the front end about money and whether or not that person is going to be able to discount you at all, and also their time commitment and their availability is critically important. There's kind of this unspoken understanding that Took my dog to get a rabies vaccine, therefore 365 days out of the year, 24 hours a day, that vet is now my dog's vet. That person is available to me. And unfortunately, we'll go through some statistics that cover why that's not always the case. So talk about that. Communicate your expectations, communicate what you might expect in terms of emergency and how often you're gonna need that person to be there. This is so important. So I have been involved with Horse Plus part-time for about 8 years. It is incredibly important for your vet to know what you have to use on each animal. And I'm sure Tawnee and Jason can explain more about that, but in a vet clinic setting, if you come in with your dog and you say, hey, I've got $500 and I wanna make sure my dog at least goes home feeling a little bit better, I'm immediately taking my whole list of differentials and I'm playing pros and cons and I'm going, okay, I know what these people have to spend. I can't spend $450 on diagnostics. I have to do the best job I can to care for this animal within those constraints, and vets will do that, but we are trained to give every single patient gold standard. If it's neurologic disease, we're gonna be like, get an MRI. An MRI costs like $4,000, right? So it's important that you guys communicate that on the front end so that we know what we're dealing with and what your restraints are. And also, how do finances impact your euthanasia policies? That's critically important to stay within our capacity for care. And sometimes, unfortunately, that means we might have a medical case that if we had $10,000 we could save, and we're gonna make a decision on that animal's quality of life, end of life, longevity, based on finances. If you don't talk to your vet about that, they're never gonna elect that option for you. But if you ask them, here's what we're working with, they can give you treatment options within your limitations, usually. Always ask, always totally okay to ask. A lot of vets have funds for helping people that can't afford it. I know 0 veterinarians who went into this field to make money. Absolutely none of us. It's a horrible choice to make money. We really want to help. Unfortunately, most vets have a ton of debt, and most of us aren't practice owners, right? Like, I'm not a practice owner. Tawnee and Jason tell me what I can spend. And when I work at a vet clinic, I'm working for a corporation who dictates what I can spend. So most vets don't have the ability to donate their time or resources without their boss's approval. So just keep that in mind. If you're asking a vet and they say no, there's probably a reason behind that. Dr. Nancy was a equine practice owner before she came to this job, so this part is all her, because I've worked for a nonprofit since I graduated. And yeah, online stuff, I won't go into detail there. This is a world of hate that we have where 99% of the people can love you, and that 1% that's gonna be critical can really just crush your career and your heart. And so make sure if you have an issue with money, just talk to your vet directly, and they'll probably explain exactly what's going on. Okay, these are the most depressing slides, and hopefully they make sense. So I added some statistics. These are from the American Veterinary Medical Association and from CDC that aren't really front and center. I know everybody knows that there's a vet shortage out there, but it's a really bad vet shortage, and it's even worse when you look at large animals. So in the United States right now, there are 78,000 licensed veterinarians. Only 3,785 of those treat horses, 4%. According to AVMA, the United States alone is 55,000 veterinarians short to meet the demand. So that is, like, when you work at a clinic, it is overwhelming. There are so many patients that need care, and there just aren't enough vets. So keep that in mind. If your vet isn't returning your call or can't give you an appointment, they care, they're doing their best. We are so shorthanded in this occupation. 50% of large animal vets, so that 4%, half of those are within 5 years of retirement. So this is the docs of the world, the old cattle vet. All of them are about to retire. Of new veterinary grads, only 1.3% are going into equine medicine. And of that tiny percentage, more than half of them leave within 5 years. A lot of them leave within 1 or 2 years. So we are losing our large animal vets by leaps and bounds. That's tough. Are all of you guys equine rescues? It's very depressing, right? If you have a vet that will work with you, hold on to that relationship and support that person, because we are a dying group of people, unfortunately. Yeah. So this slide touches a little bit on it. but I can explain more as well. I was really surprised by this. So this is a statement CDC put out in 2022. 80% of veterinarians experience clinical depression at some point during their careers, 80%. 8 out of 10 vets. I'm super duper optimistic, happy. I've been in therapy because of my occupation, and it's surprising to hear that, but this is a tough job. You guys, I'm sure, have all experienced compassion fatigue, but veterinarians are also 2 to 4 times more likely to die by suicide. That's not make a suicide attempt, that's to actually die by suicide than the general population. So veterinarians are a very at-risk group for mental health. More than 60% of vets across the field just leave this occupation. And reported reasons for leaving all kind of center around burnout, compassion fatigue, working really long hours and having very poor work-life balance, working with difficult clients and having very high levels of liability are the most commonly reported reasons for leaving the field. So, super depressing. Next time you deal with a vet, just keep in mind, doesn't matter how happy or financially successful or stable this person might be, they're probably having a very difficult time in this job. I didn't put the statistics in here on support staff, but the veterinary profession is also very understaffed in terms of support staff. So all of us are struggling. We're all trying to do our best. And I think that's important for all of us to remember, no matter who we're dealing with, is keeping that in the back of your mind when you're dealing with horse vets. Sorry for being so depressing, you guys. Okay, so time commitment. This is a really important one because you are most likely to have a very stable, positive relationship with a veterinarian who you see regularly. They will see what you do, they will value your time. It will be easier for them to make time for you if you are a regular client. You might not need a regular vet, and that's okay too, but just keep in mind, if you're trying to book an appointment and you're being told an appointment is 6 months in advance, it probably literally is in advance, but that also means that vet is probably spending their after hours time in any spare second they can, bending over backwards to help their existing clients. So the veterinary shortage crisis means vets, especially in large animal medicine, are extremely busy providing care for their existing patients, who they will prioritize over new clients. And that designation between patients and clients is important. I'll go over what the formal relationship between a vet and their patient is, but my job is to advocate for your animals, not you. So my job is always to look at the animal in front of me and advocate for that animal. I have to explain it to the person paying the bill, but there will be times where your veterinarian isn't doing what you want, and it's because we took an oath to prioritize your pet and to advocate for what your pet needs. Oh yeah, this is again, thanks Dr. Nancy. So in some areas, there are really large equine practices and they might have 8 or 10 vets and you kind of don't know who's gonna show up on a farm call. That's important because you might have one vet see an animal and prescribe a treatment plan and have a follow-up visit with a different vet who gives you a totally different answer and you're like, what is going on here? We thought we knew what was going on with this animal. Why are we changing the plan? And sometimes, unfortunately, there are egos, there are differences of opinion, so trying to navigate that, if you do have multiple veterinarians, if you ask 10 doctors, you're gonna get 10 different opinions, right? Medicine is an art, not a science, so sometimes we are wrong and sometimes a different opinion will give you a totally different idea. I think it's safe to say that most veterinarians are thrilled for a second opinion. In some cases, you have to have more than one veterinarian because your regular vet may not provide emergency services, and that's an excellent point. And I think in urban areas, that's almost exclusively the case, is that a regular GP vet is no longer handling emergencies. In a lot of rural areas, you still have the docs of the world who are within 5 years of retirement who will still answer their phone at 3 a.m. and show up. And I'm so grateful for those people who don't have good work-life balance. But yeah, there are. And in an emergency situation, ER vets are trained to triage only, most of them, right? So they're like, is it gonna die tonight? And I'm gonna get you to the morning and I'm gonna hand you off to the GP. So that is a really, really important relationship to have as well, because sometimes if we take the x-ray at 8 a.m. instead of 3 a.m., it's gonna cost us $700 less, right? But you don't wanna insult that ER vet. So making sure an emergency veterinarian knows you have a regular veterinarian, you have a positive relationship with that person. And honestly, we're a pretty small group of people. Most of us know each other. Like, I know all the ER vets, equine and small animal, and I communicate with them directly about my patients. So if we have somebody that we're like, these people are awesome, they're gonna know that, and they're gonna keep that in mind when they're treating your animal.
The caveat I'll put to that is that, like in my situation, my existing vet has hospital rights with TUPS, and so she says, call me first, I'll get you.
Perfect. Yeah. So he's saying he has an existing relationship with a university that his GP veterinarian is able to kind of bypass the system and get him into emergency care or specialty care more quickly, which is incredible. I wish we had a closer option like that here. We don't have a lot in Hohenwald, but we have a coffee shop now, which we're happy about. So this is an interesting one that most people probably aren't aware of. Some vets work on production. So some vets have a salary where they make X amount per. Some vets have a combination, and some vets only get paid based on what they produce. So that's a tough one. If somebody's trying to make ends meet and they don't make enough money in a given month, then they actually end up paying their employer to work for their employer, and that happens a lot in large animal, which is really tough, right? So if you have a vet that you love and you're like, oh, this is so great, these people give us a discount, and that vet starts being like, oh, Steve, why don't you take the farm call to this place? And you're like, what happened? It may be that that vet can't allocate 50% of her time to come to your farm. If she's working on production, she has to offset shelter discounts by working with clients that don't get discounted. So this feels like a tough one to ask your vet, but there may be a case, especially if you're working with an associate. We are moving away from this model because there are so few vets that we're able to advocate for ourselves, and nobody actually wants to work on production, but that's a tricky one that you may not be aware of. And again, just clear expectations. Before I was full-time at Horse Plus, they purchased a lot of the supplies, and I just worked hourly, which worked great for me. It's a little tricky when you have controlled meds in the equation, and it requires a lot of trust. So I'd known Jason and Tawnee for a really long time. I trusted them. They had staff that I trusted, and I felt comfortable doing that with my license. Not every vet is gonna feel comfortable doing that. So working out details, if you do have a vet that's working for you a lot, they might be like, yeah, absolutely, you guys get all your own XYZ vaccines and stuff, and I can use your supplies when I'm there. They might be really uncomfortable with that, or they might be very comfortable, but you can always ask. It doesn't hurt to ask and say, hey, we're trying to offset costs. Is there anything that we can do that you would still feel comfortable with us doing? This slide I thought was very interesting. Jason and Tawnee put this together. So let's talk for a second about staff veterinarians, which this is my first year working full-time for Horse Plus. I hope I covered this okay. So if you're spending more than $10,000 a month in veterinary care consistently for more than half the year, and you have about 50 horses on site and 20 horses coming in monthly, you may end up spending less money on veterinary care if you can just hire a full-time vet. And I will tell you, a huge incentive for me working for Horse Plus is that I don't have to deal with clients. So I know that if I show up and I say, this is the call and here's the treatment plan, I'm not gonna get pushback, and it's gonna get taken care of to specifications. So that is a huge incentive that veterinarians will want. So it is, even if you can't be financially competitive, just that alone takes off a huge part of that compassion fatigue and burnout that happens in our profession. You guys, if I had done this talk, I wouldn't have talked about money at all. I don't like money. I'm not good at talking about it. So I'm really thankful that Dr. Nancy covered that, because it is really important. Thankfully, someone else pays all of the medical bills at my job, and I just treat animals. So that's lovely. Roles and boundaries. So I think I'm in a unique position in that, having worked for a nonprofit, I love my support staff, and I use my support staff so much. Before I was full-time at Horse Plus, I would show up, and their 2 technicians had all the supplies organized. They knew what I needed. They knew where it was clean, and they had all the patients lined up and ready to go, all of the pre-stuff done, and they'd be like, here's our priorities. And we would just get through as many things as we could in a day. That doesn't happen without that support staff, right? If your vet shows up and you're like, yeah, Doc, he's in the back 40, we're gonna have to shoot him. That takes the amount of patients they can shoot them with the tranquilizer gun. Sorry, I should have clarified, right? I've had this happen where you show up to look at one animal and you're like, okay, I got an hour for this farm call, and they're like, this horse is out in a 40-acre field, not halter broke, and they're like, yeah, you're gonna have to tranquilizer gun this horse to get hands on it, and you're like, great. So the opposite of that is, if your staff is trained, if your facilities are designed, if you are organized and you know what you want out of a visit, you can get so much more work done from any one vet visit than you could without it. And this is definitely an area where I promise you, no vet is gonna have an ego about you going, here's what's normal for this animal, here's the whole history, this is exactly what happened, here's pictures of this wound yesterday and at 3 a.m. and this morning. Here's what this animal's like to deal with. This is his favorite person. Any of that information, our farrier knows about his radiographs. Using your staff to give good histories and to provide support will go so far. Yeah, and then in return, respect what your vet is giving and don't try to dictate what's done. So I have worked with a couple rescues that show up and they're like, I want this cat to have vitamin B12 sub-Q fluids and these 4 medications at this mg per kg dose. And I'm like, okay, well, it doesn't really work that way because you're telling me what's wrong with this cat, right? And in this situation, this woman had been doing rescue for 30 years, but she was probably right a lot of the time, but approach that a little bit more strategically and say, hey, we've dealt with this one disease a lot. Here's the history and here are all of the symptoms of this cat. And it's okay to be like, maybe it's S5E, you know, but going to your vet and being like, this is what I need you to do, try to be tactful with that, because that will set a lot of vets off on the wrong foot, being told what to do. We went into massive amounts of debt so we could tell other people what to do, which is, also you can be a parent and do that same thing. That's right, for a while anyway. So again, with respecting roles and boundaries, the internet is wonderful. It is a great tool, but Dr. Google and Facebook groups often will not help you out. It is appropriate to ask your vet, hey, I really want to learn more about laminitis. Do you have a recommendation about a paper I could read or a source where I can learn more so I don't have to ask you all of my questions? We're all nerds. All of us are huge nerds. And we will tell you what to read and what's worth your time and be super grateful for that. We also love getting articles, right? Like I have people mail me papers and articles and are like, have you read this? And often I haven't. So you're not gonna insult your vet by being like, hey, we found this great article on this topic. Most of us are reading anyway and are happy to have that. So there's a big difference between, we figured out what's wrong with this horse and this is what we want you to prescribe, and we've put a ton of thought into it, we don't know what's going on, but here are some things that we found helpful. This is the fun side. There's a lot of asterisks down here at the bottom, and Tawnee and Jason have talked a lot about this, but there are some surgeries that people can perform, like, did you know that it is legal for you to castrate your own horse, which I think is kind of terrifying as someone who does a lot of equine castrations. There's a lot of bleeding involved, a lot of big body parts. But anyway, it is illegal for a non-veterinarian to diagnose an animal, perform most surgeries, give a prognosis. That's a weird one, right? I wouldn't have known that this was here if I didn't look it up. So telling you your dog's kidney disease is stage 2 versus stage 5, legally only a veterinarian can do that. You might be able to kind of find that out if you have the diagnostic tests, but it's your vet's job to tell you from a health perspective whether or not an animal has a good prognosis for a quality of life that meets what you want that animal to do. So sometimes that's just a pasture pet. Sometimes that's upper level dressage, right? But it is actually legally your vet's job to assign a prognosis to an animal. And that's not something we always get to. Honestly, like often you do a lameness exam and you're like, yep, it's the right front, here, give some bute, and let's recheck it in 4 weeks. And you can be like, hey, 4 weeks on a medication is a long time for us. How are you feeling about this case? What are you thinking about the prognosis? Don't be afraid to ask if you're not getting that. And also sometimes it's okay to be like, when you have time, will you follow up with us when you've had a better chance to look at the radiographs and just give us a better idea what you think about this animal's prognosis? I'm not all vets, but sometimes it takes me a minute. Like I have to sit with a case and think about it and sleep on it, and often I'll send a colleague images and be like, what do you think about this? Did I interpret it right? So your vet, I promise, is waking up at 3 a.m. and thinking about those hard cases and wanting to make the right call. So sometimes giving us a little bit of time just to be like, hey, when you have time, can you follow up? Most of us don't mind being nagged. We're not very good at returning stuff, but that is totally okay too. And then obviously prescribing medications and treatments. And this includes, interestingly, say you're using large animal ivermectin on a dog, and you call your vet up and you're like, hey, I bought this at Tractor Supply, what dose can I give my dog? Not legal for them, not legal for a non-veterinarian to tell you that, even if you can look it up. So if you're changing a labeled purpose or amount, legally only a veterinarian can do that. I think Dr. Jean is also going to talk about the valid veterinary client-patient relationship, but have any of you guys heard of this before? No one's heard of this? Okay. So it's kind of like entering into a dating relationship with somebody, only it's legally binding. So you might not know this, but any vet that sees any patient is entering into a veterinary client-patient relationship, and I'm going to go over the 5 things that covers, but if you have a vet that's hesitant to see you because they've never seen you before, I promise you, these things are in their mind. They're entering into a legal relationship with you, which I'll cover this in a minute. You can break that relationship at any time, but your veterinarian cannot unless certain things are met. So there's a lot behind that. Even if it's something as simple as like, hey, can I get my dog's heartworm medication refilled online? I get this question all the time from like my aunt, right? And I'm like, well, I haven't seen your dog in a year, so I can't really say that I have a valid VCPR with your dog, even though you're my aunt and I know you. Like, maybe over Thanksgiving I can look at your dog and then I can. So one of the things that a vet pledges to do, and this is inherent, any patient that we see for any reason, we are in this relationship with you. Your vet has assumed the responsibility for making clinical judgments regarding the health of the patient, and the client has agreed to follow the veterinarian's instruction. So this is saying that we are taking responsibility for your pet's health and you are agreeing to follow our instructions. That's why we have against medical advice forms, because basically saying, yep, I see that's what you're recommending and I'm not going to do it. Legally, we have to document that you said no. So if you've ever been in that situation, it's kind of awkward. But this is a legally binding document for us as vets. Another one of those things that it touches on is saying that your vet has sufficient knowledge of the patient to initiate a general or preliminary diagnosis of the medical condition. Great example of this is, my horse is limping, can I give it bute? Usually your vet's gonna say yes, right? But if you look at this one, and we haven't seen your horse in 6 months, can we make a preliminary diagnosis based on a video or a photo or a description on the phone? Maybe we can, but what if it's osteosarcoma and we're completely wrong because we didn't put hands on that animal? Or what if it's your dog is coughing and you think he needs antibiotics, but he's dying of end-stage heart disease? You know what I mean? So this is a serious one that we think about with every single case. Another one says the vet is readily available for follow-up evaluation or has arranged for emergency coverage and continuing care and treatment. So I'm only available at Horse Plus Monday through Thursday. I'm not here Friday, Saturday, Sunday. So if I spay a dog on Thursday and she goes home, I'm not available on Friday, Saturday, and Sunday. And so your vet might have an agreement with a teaching hospital or an emergency service, but they legally have to say, I am or am not available, and that's a really important one to make sure. And we take that really seriously, and that's why so many of us are burned out. We also are pledging to provide oversight of treatment, compliance, and outcome. So we actually do want to know if we come see a lame horse, we want to know the outcome. We're pledging to say that we are providing oversight, not just for diagnosing your horse in the first place and prescribing an appropriate treatment, but we want to make sure that you're actually giving this animal their medication as prescribed, and we want to know if that animal gets better or not. Yeah?
So our vet sends us text messages after every appointment to follow up. Is that something that we should respond to, or is that just kind of a general?
No, we love a dropped text. If the ball's in your court, you do not have to respond. You can do a thumbs up, but yeah, I promise. So your vet is probably fulfilling this, right? Like he or she is following up. And saying thanks, great. Promise you, nobody's gonna be like, I can't believe I sent them that, and they didn't send me a long response. Totally okay. I'm an oversharer, and I love communication, and I love a drop text thread, so yeah, don't worry about that. Oh, patient records, this is a fun one. So a lot of rescues, you guys probably all have wonderful records, but veterinarians have a different level of record keeping that we have to adhere to that is very strict. And this includes really basic stuff. Deworming that you can buy over the counter. If we're your vet providing oversight, we're supposed to know and have record of those things. So this one can be really hard. I get a lot of requests from small rescues, hey, can you get us a bottle of doxycycline? Which I can legally do, right? But then which dogs are getting the doxycycline, and are they following correct prescribed amounts, and how are those dogs doing, and is this getting appropriately recorded? So if these animals are getting adopted out, and an owner says, hey, this dog was Ehrlichia positive, and you're saying that it was treated, but where are the veterinary records that show it was treated? My vet is saying, if it's not written down, it didn't happen. So if you have a vet that gets dicey with trying to cut corners, this is probably why. All of these things are probably why. And if you can have, Horse Plus uses Shelter Love, which is great. If you have a system where you go, here's our medical record documentation, it meets all of the legal requirements for a vet, and we have a registered technician who's volunteering to help us enter this information so that if you pop by the shelter, take a look at these 5 dogs and prescribe these medications, our record keeping is covering that these animals are done appropriately. And under those circumstances, I'll be like, fantastic, and I'll touch base with those animals, but record keeping is super boring. Nobody likes to do it. I hate records. So important to keep really good records. Oh, this is a fun one. So you guys can fire your vet anytime. Like you can just be like, nope, we're done. Your vet cannot terminate the VCPR if there's any ongoing medical or surgical condition without either continuing to provide care for the animal or making sure that you can get it somewhere else. This is a tough one in small towns, right? Like if somebody's really awful to you as a vet and their animal is super sick, I mean, legally I could tell you emergency care is located 5 hours away, but I'm gonna feel guilty about that, and that makes it really difficult. In my opinion, that's a lot why that 80% clinical depression rate happens, because there's misunderstanding on top of misunderstanding, and then broken communication happens, and you guys can just be like, well, fine, I'm just gonna call another vet if you can get one, and your vet can't drop your animal because they've taken an oath not to. So I don't know if you knew that or not. But I get a lot of HIPAA questions. I came from the Zoom ed world, and we share everything because there's like only so many tigers in the world, but there isn't a veterinary HIPAA. There is kind of this unspoken expectation of confidentiality. Most vets I know share cases pretty openly, but we don't say whose animal it is. Like I'll send hog radiographs to a colleague and be like, hey, do you think this is a surgical case? What do you think about this? However, gossiping is never okay. So if you're ever in a position where you're like, I know this is my case and I know that this is getting talked about, call your vet up and just tell them straight up. Could be your vet, could be support staff, could be a crazy radiograph that we've never seen before that we want to show all our friends because we've never seen a dog swallow a giant spoon. Legally, you wouldn't have a case to like sue your vet on that, but it is a level of respect and confidentiality that is assumed. And sometimes as rescues, we have cases that are really hard to message to the outside world because people don't understand that. So make sure if there's ever an issue with that, just call your vet up and be like, hey, I was in Walmart and I heard somebody talking about our horse. Did you talk about this with somebody else? That's a hard conversation to have, but if you are in rescue for years and years and you work with the same person for years and years, spending time to build that relationship and being direct is really important. Yeah. I don't think there's any one best answer on how to communicate. I would ask your vet, hey, do you like text messages? What's the best way to get in touch with you? And I like emails, but I always tell people, if I haven't emailed you back within 5 days, it's never gonna happen. Email me again. Like forward me the same email again so it's in the top of my box. And I think some people might be offended by that. I'm just really grateful because I get so many emails, I get buried. So ask your vet, be like, what do you need? And like, hey, if I ask you a question, at what frequency can I follow up with you without being annoying, right? We all appreciate that. Yeah, things happen. We're all, we're flawed humans. So at some point, we took in more than 57 horses at Horse Plus last week, and Dr. Gina and I looked at them in 2 days. So did we miss something? Absolutely guarantee you we missed something in those 2 days. But things happen with different cases. You can have bad reactions to medications. You can have complications. You can have bleeding after surgery. You can miss a diagnosis, especially if you're working within a like, hey, we got to pick one diagnostic. Your vet might pick the wrong one. You know, we might be like, well, we could do an ultrasound or an x-ray, and we pick the one that we think is gonna give us the answer, or we can do a CPC or a chemistry. We make mistakes, we misinterpret stuff, we might pick a wrong drug. So good communication is really important, and showing each other grace in that, and recognizing that we're all trying to do our best for those animals. Dr. Nancy also put this one in, and I thought it was kind of funny, and I thought about it a lot, and I was like, I'm gonna leave it in here. So I recently left a job that I adored after 10 years, and it was really hard for me. I left because of work-life reasons and because I felt called to make a change, but I do think it's important to note that relationships sometimes do come to an end, whether it's your vet of 30 years is retiring, or they're moving to another practice, or they're really burned out and they can't do it anymore. So just treating each other as human beings and being tactful and kind and respectful. Keep those statistics in mind. In 10 years, there are gonna basically be like no horse vets out there. We're dying out. So burning a bridge isn't the right choice anyway, but burning a bridge in a small town or in a veterinary group and being branded as a really difficult client, not that you can't come back from that, but you know, be professional and tactful and respectful. That's only gonna help you in the future. And I say this, you know, the fault can be on either end, right? Like, we're all humans. So not to say that the fault is on anybody's end, but relationships do come to an end. So show each other kindness. Dr. Nancy also put this in. I tell my kids this all the time, just no talking. Okay. I don't have a lot of time, but I'm happy to answer any questions you guys have. Why is such a small percentage of new veterinary graduates going into equine medicine? I can try to answer this like based on my experience. The starting vet salaries for an equine vet are less than half of a GP veterinarian. So most veterinary student loan debt is astronomical. A lot of the students are graduating with about $500,000 of debt. I'm 10 years out, but I still eat ramen every day, and I'm still paying off my student loan debt. So keeping that in mind, you know, you've been to school for 8 years past high school to get this degree, and you're looking at making, you know, less than a dental hygienist, or you can make better as a GP. So a lot of large animal people go, all right, I'm gonna go into a mixed practice, which everybody loves, because then that practice can say, great, we can still see horse cases. And then I think another huge one is, the reason for that disparity is, horses don't come to the hospital usually. Sometimes they do, but usually it's a vet and a technician going on a farm call. So if you're somewhere where you're driving between visits, I worked a shift at the local small animal hospital, and I saw over 50 appointments between 8 a.m. and 1 p.m. in a small animal clinic. I had 6 assistants. I was running 4 rooms. That's a ton of patients, right? So you take that amount, and I could have seen maybe 1 client per hour in equine practice. So from an earnings perspective, if you're looking at making ends meet, you almost can't. And then cattle are even harder, right? Because you have like $100 in a cow, and it costs that much to set foot on that farm, and you want to help this producer out, but it's tough to make ends meet. So I think financial is a big part of it. I think families are part of it. So overwhelmingly, new veterinary graduates are women, and I think part of the statistics for equine veterinarians leaving the field are safety. A lot of us get put in positions where it is not safe. Horse Plus has incredible support staff and a hydraulic chute, and I can go, yep, I don't feel good about this. And we literally have, I don't know if he actually is a football linebacker, but like, we've got a big dude who's great with horses who can keep me safe doing it. But a lot of vets aren't in that position. So either they've been made to feel unsafe by large animal, or, I hate to say this, in a lot of cases, they're made to feel unsafe by clients. So if somebody gets up in your face and threatens you, and you're there with a high school student out in the middle of nowhere, you start feeling uncomfortable really quickly. Or, I have 4 kids, you might start having kids and being like, I can't get home at 8:30 p.m. every night and be up at 3 a.m., but if I pick up a GP shift, I have more regular hours.
So, given the disparity, and it seems like there's going to be a tipping point at some point.
Yeah.
There's just not enough equine vets to go around.
Yeah, I think we're already there.
And so as a large animal rescue, who have multiple horses, what are organizations like this to do for these situations?
Honestly, I think Horse Plus's model has been very effective. They were able to recruit an intern. So there are 2 full-time vets working at Horse Plus. My colleague who you'll hear from, she's not really an intern, but she...
Let's assume we can't afford to hire...
So could you split a vet with another organization? Or could you find somebody and say, hey, we'll give you 2 full days a week every single week without on-call expectations? I would put out what your need is and see, and I think the strongest thing you guys have to offer veterinarians is understanding. And if we feel like you're not gonna cuss us out or hate us online and be understanding and follow our directions, and if you have good support staff, oh man, I love that. I love to go to a farm and see 11 horses in one visit, because that helps the farm out, and it really also helps the vet out because we feel like we're accomplishing more. But I wish I had a good answer for you. I don't have a great answer.